So let's get into it. The situation, the tobacco industry has a long history of creating and reinforcing this belief that stopping one's tobacco use would be too stressful for folks with behavioral health challenges. And again, where did that come from and how and why that was developed is a very interesting story. So back in the day, as I said, we had this is in the mid 20th century, the research was being published. The tobacco companies started really freaking out over it, if you will. There's some interesting stories behind the interacting internal memos and different things among the tobacco industry in terms of how they were concerned about that. But they developed a very comprehensive strategy here to counter those findings, create doubt, reframe a narrative. So it was refocusing the purpose of promoting tobacco use by means of a different narrative. They would have, these are people with deep pockets. So they actually developed their own studies to point to data that was bogus, but it could be used in their advertising and sponsorship and, again, promotion of cigarettes. Now, this, of course, was targeting the general population. Back in the 1950s and 60s, tobacco use was very prevalent, but it really had an impact specifically to those who have elevated life stressors. And I have the list here of the targeting that went on here. So this began, this is a memo from 1954 from a Miami-based ad agency to the American Tobacco Company on Fifth Avenue in New York City. And it really paints a picture of the strategy that they really embraced for many decades afterwards. It really is acknowledging that due to an increase in the lifespan of people in the United States, this idea that tobacco use is hazardous to one's health just doesn't make any sense. There's a lot of people that use tobacco, they say. Why would our life expectancy be increasing if that were the case? But what we can say, this gentleman, Harry Cheplik from this ad agency, said if we focus on how this can be an aid to manage stress in one's life, one's mental health, that's where we need to focus the energy. Let's discuss how the use of cigarettes can help us find happiness, pleasure, and good mental health in life. So they actually developed studies. This is one a number of years later in '72 from McGill University, where there was this Dr. Selly who proposed this project, and he talked about deviation of stress being necessary. And he specifically acknowledged that cigarette smoking is an acceptable deviation. This was the tobacco industry in conjunction with the Canadian tobacco companies that actually coordinated that study. We're all too young to remember how they used the data, but these ads go back to the 1950s and early 1960s. And you'll see that this is very direct messaging of how tobacco use is helpful to our mental health. We're talking about telltale signs of jangled nerves. What every woman should know about our nerves. Here's a 1950 housewife taking a break while doing her vacuuming, apparently. And these happy, busy people find more joy in living because they light up a Camel. That, again, the ads are very much focused directly. It's a psychological fact. Pleasure helps your disposition. It takes healthy nerves to fly the mail at night. So that pilot obviously uses tobacco products. Do you smoke your anxiety away? We have a cigarette for you. Let it up before your nerves get tired and tense. So all of these messages, again, now in this day of social media, we are very aware of influencers online. And how you create a narrative, whether it's factual or false, really doesn't make any difference. it has this echo effect. You repeat it enough, people start to believe it. Well, the focus that was put into place in those days really was looking at how tobacco use is beneficial to our mental health, to our happiness, to our emotional well-being. Happy, pleasure, you're looking for these types of things in life, we have the answer for you. And it also, again, here's cigarettes are like women. The best ones are thin and rich. Rather a dated message, I would propose. But again, it's I wonder how many people experienced eating disorders because they were smoking instead of having lunch due to some of the messaging that we see here. Reach for a Lucky instead of a sweet.